This meeting to order. Welcome to meeting number 138 of the House of Commons Standing Committee on Health. In accordance with our routine motion, I'm informing the committee that all remote participants have completed the required connection tests in advance of the meeting. Pursuant to an order of reference of May 29th, 2024, the committee will resume its study of Bill C-368, an act to amend the Food and Drugs Act, Natural Health Products. I'd like to welcome our panel of witnesses. We have here with us Joel Tuna, General Manager, Purely Canada, representing the Canadian Lung Association, Sarah Boutsen, CEO. She's appearing virtually. From the Heart and Stroke Foundation of Canada, Forum Patel, Policy Analyst, and from the Hospital for Sick Children, also appearing by video conference, Dr. Charlotte Moore Hepburn, Medical Director, Child Health Policy Accelerator, Department of Pediatrics. Thanks to all of our witnesses for being here today. You will have up to 5 minutes for an opening statement, followed by rounds of questions from the parliamentarians here. We're going to begin with Mr. Tuna. You have the floor, sir. Thank you.
Thank you for inviting me here to be here today. My name is Joel Tuna. I'm a fourth-generation master herbalist and the general manager of Purely Canada, my family's small business. We directly employ 10 people in our building, and we indirectly help employ many more Canadians through our distributors, brokers, farmers, and supplier network, which is in every province. For 135 years, my family has manufactured what are now called NHPs in Canada. We are a compliant company with over 500 product licenses. In my 50 years in the industry, I have seen the landscape change time and again. I testified before this very committee 26 years ago regarding the inappropriateness of Canada's regulations treating NHPs as drugs. This committee consulted with Canadians and issued a report, Natural Health Products, A New Vision. In 1999, the Liberal government's Minister of Health, Alan Rock, announced the report and all its recommendations were accepted by this House. The report's guiding principles included that NHPs are different in nature from and must not be treated strictly as either food or pharmaceutical products. NHP regulations must not unduly restrict access by consumers. NHP regulations must not place inappropriate costs on industry, consumers, and government. Information regarding decisions and regulatory system must be readily available to NHP stakeholders. As an industry, we had high hopes that the resulting legislation and regulations would once and for all be appropriate to NHPs. The NHPD was set up, and through wide consultation, Canada achieved the enviable. We had laws and regulations that protected consumers, gave them access to the products they wanted, all with industry buy-in. Businesses were licensed, and products required pre-market licensing. Repeatedly, we have heard that Canada had regulations that were the envy of the world. Over the past 4 years, multiple laws and regulations have been introduced without meaningful consultation or proper economic impact assessment. This patchwork system is causing myself and my colleagues to question the viability of Canada's NHP sector. I was asked to estimate the cost to my small business. We estimated the first-year cost to exceed $500,000, with annual costs exceeding $300,000. These days, no small family business can survive with these additional costs. Classifying NHPs as drugs is inappropriate. One complication of this is putting NHPs under Vanessa's law. This is using a jackhammer to swat a fruit fly. Existing measures such as inspection, stop sale, seizure, and license suspensions are rarely used. Regulation without enforcement is meaningless. Health Canada has the power to suspend licenses if required. Industry is happy to consult on appropriate regulations for recall. New labeling requirements based off of drug labeling are to come into force. These regulations do not provide any new information to consumers, but rather make the packages confusing, increase costs that are going to be passed on to consumers. Additionally, these regulations will reduce the likelihood of package recycling, needlessly increasing our industry's carbon footprint. Foreign actors see the easiest and cheapest route for Canadians is through the personal use importation framework. A significant portion of Canadians now buy product not captured under Health Canada regulations, exposing them to unacceptable risks. I have in the past and again questioned Health Canada. If a product is potentially harmful, how is it potentially harmful only when manufactured in Canada, but not if imported? The big sticking point I have is that Canadian companies are investing to be compliant, yet are losing a lot of money and a lot of jobs. Canadians who buy NHPs from outside Canada are bringing in a combination of products they can't get here and products they can. They do this to reduce their shipping costs. This is destroying Canada's retailers. So you understand the depth of the problem? There are foreign companies that have warehouses in Canada housing their non-licensed products so their customers can get fast, no border issue shipments. This means no tax revenue and no Health Canada oversight. In the end, Canadians want what they have today: access to safe, well-made products. Bill C-368, along with extensive and meaningful stakeholder consultation prior to new regulation and law introduction, is a good starting point to bring Canada back to the guiding principles which are supposed to guide all legislation and regulations for NHPs.
Thank you, Mr. Tuna. And next, on behalf of the Canadian Lung Association, we're going to go to the screen for Ms. Putson. Welcome to the committee. You have the floor.
Okay, thank you very much, and thank you to the committee for inviting me to speak here today. Again, my name is Sarah Butson. I'm the CEO of the Canadian Lung Association. Our organization has spent almost 125 years focused on helping Canadians breathe. We do this by funding research, leading advocacy, and providing health information to Canadians. And we have a long history in tobacco control, given its devastating impact on the health of our lungs. Still today, it remains a leading cause of preventable disease and death in Canada, and in particular, a primary cause of lung disease. And so with that context, I am pleased to speak to you today regarding Private Member's Bill C-368, an act to amend the Food and Drugs Act. Our concerns with Bill C-368 primarily rest with the potential unintended consequences should the bill be adopted in its current form, and the potential to undo important new restrictions put in place through a ministerial order called the Supplementary Rules Respecting Nicotine Replacement Therapies Order. This order restricts the availability and appeal of some orally administered forms of nicotine replacement therapies, such as nicotine pouches. This keeps them out of the hands of children and youth. We are appearing today to urge that if Bill C-368 is adopted, that it be amended so that it would not impact nicotine products. In the fall of 2023, Imperial Tobacco Canada announced that it had begun selling nicotine pouches under the brand Zonic. Zonic had been approved under the Natural Health Product Regulations, and soon these products were available at local convenience stores, sold beside candy, with enticing flavors, packaging, and promotion seemingly aimed at a younger generation. It also meant that there was no minimum age of purchase, marking the first time in modern history that a nicotine product owned by a tobacco company could be sold to minors. CLA was amongst a group of concerned national health organizations that immediately urged the government to take action. And swift action was indeed taken. This demonstrated the commitment by decision makers to protecting young people from the influences of the tobacco industry. These products should never have been made available in the manner that they were. As an organization that has dedicated decades to protecting lung health, we were deeply concerned and outraged about the potential for this product to hook a new generation, which may lead to a lifelong battle of nicotine addiction. The ministerial order that I mentioned above puts in place several important measures. It ensures that nicotine pouches are only available for sale behind the counter at pharmacies and limits the available flavors to mint and menthol only. We know that limiting access and reducing the appeal of products are policy measures that can have an impact on the likelihood that young people will use these products. The order also places limits on advertising and promotions, requirements of warnings and advising statements, and importantly, this order does not negatively impact other forms of nicotine replacement therapies that are currently available, which we know that the over 3 million Canadians who currently smoke and may want to quit may need to access those supportive cessation aids, while at the same time ensuring a new generation is not enticed. The ministerial order righted a wrong that should never have occurred, and we want to ensure those protective measures stay in place. As a result, we would once again urge that if adopted, Bill C-368 contain an amendment that would not apply to nicotine products. I thank you for your time and consideration and would be happy to answer any questions.
Thank you, Ms. Butson. Next, representing the Heart and Stroke Foundation of Canada, Forum Patel. Thank you very much for being with us. You have the floor.
Thank you, Mr. Chair and committee members. Heart and Stroke appreciates the opportunity to appear before this committee to discuss Bill C-368, an act to amend the Food and Drugs Act, natural health products. Let me be clear, Heart and Stroke is not against improved access to natural health products. I'm here today only to address the unintended consequence that this bill would have on the regulation of nicotine pouches and other new and emerging nicotine products that could lure children and youth into nicotine addiction. As it stands, the bill would exclude natural health products from the definition of therapeutic products. This change would be problematic because of its implications for the government's ability to regulate nicotine pouches and other nicotine replacement products, which are currently classified as natural health products. The Food and Drugs Act only applies to therapeutic products. So if natural health products are no longer classified as therapeutic products, there would be no act under which the government could regulate all these products. And this is a gap that leaves our youth especially vulnerable. In August 2024, Health Canada adopted supplementary rules respecting nicotine replacement therapies order. It included many provisions intended to keep nicotine pouches out of the hands of young people, such as requiring nicotine pouches to be sold in pharmacies only and for them to be placed behind the counter, banning flavor descriptors that can be appealing to youth, and only allowing mint and menthol flavors, adding health warnings to the nicotine pouch packaging, as well as banning advertising, packaging, as well as labeling that can be appealing to young people. Prior to this, the unregulated sale of nicotine pouches such as Zonic posed a danger to young people in Canada. As health advocates, we are long familiar with the methods of tobacco industry and how it uses tactics to hook young people onto its products. First, it was cigarettes and chewing tobacco, then it was vaping, and now it's nicotine pouches that risk addicting a whole new generation. We know that nicotine is one of the most addictive substances on earth. It affects adolescent brain development, particularly the parts of the brain that control learning, attention, mood, and impulse. We now have important measures in place to protect young people from these harmful products, which research has shown to be a potential gateway for future use of vaping and tobacco products. However, these measures are currently being threatened by Bill C-368. To conclude, I urge the committee members to support an amendment to the bill that would address the concerns that have been raised by health groups, especially regarding nicotine products. We urge you to keep in place the supplementary rules respecting nicotine replacement therapies order. No one was prepared for the aggressive marketing that the tobacco industry would use to target our teens, and now we have some of the highest teen vaping rates in the world. We can't repeat this mistake with nicotine pouches. Children and youth deserve to be protected from the predatory tactics of the tobacco industry, which is now trying to skirt the rules with nicotine pouches and other nicotine replacement products. Thank you.
Thank you, Ms. Patel. And next, we're going to go back to the screen for Dr. Charlotte Moore Hepburn from the Hospital for Sick Children. Welcome to the committee, Dr. Moore Hepburn. You have the floor.
Thank you so much. Good afternoon, everyone, and thank you for the invitation to appear. My name is Charlotte Moore Hepburn. For the last 18 years, I've practiced pediatrics at the Hospital for Sick Children, which is Canada's largest children's hospital. I'm also proud to serve as the Director of Medical Affairs for the Sick Kids Child Health Policy Accelerator, where our mission is to bridge the gap between medical evidence and public policy in order to optimize health outcomes for Canadian children and youth. As it stands, we have serious concerns about Bill 368. We feel this bill would significantly weaken the regulatory protections over natural health products in Canada, reducing the essential safety and quality standards that are currently in place. This would fundamentally compromise both provider trust and consumer trust in all NHPs. Since becoming a physician almost 20 years ago, our understanding of and appreciation for natural health products has substantially increased. The evidence base supporting the use of NHPs has expanded over time, as has an appreciation for the importance of identifying and reporting adverse events and drug NHP interactions. As a pediatrician, knowing that NHPs are well regulated, I'm comfortable recommending NHPs to my patients when and where appropriate. We also now actively train medical students to make sure we ask all patients without judgment if they are using natural health products in parallel to the therapies that we prescribe. Should NHPs fall outside of the definition of therapeutics under the Food and Drug Act, should those critical regulatory standards and safeguards no longer apply, my comfort and ability to recommend NHPs to my patients would have to change. In addition, and importantly, Bill 368 presents a serious and immediate risk to children's health given the current regulatory status of synthetic nicotine as a natural health product. As pediatricians, my colleagues from across the country and I see firsthand the devastating impact of nicotine addiction in our patients. We care for 7th and 8th graders who started vaping even before entering middle school, who now require professional support in their efforts to quit. We care for young people in high school with disrupted sleep and decreased appetite and poor academic performance, all of which can be attributed to their nicotine addiction. And sadly, we've stabilized not only teenagers, but also toddlers suffering from intentional and unintentional acute nicotine toxicity secondary to nicotine exposure. We failed our children so profoundly when the threat of novel nicotine delivery systems and other non-combustible nicotine-containing products first presented themselves. And as mentioned by others, Canada now sadly leads the world in terms of youth vaping rates. With synthetic nicotine products like nicotine pouches now on the market, regulated as NHPs, with this bill we could fail risking them again. There must be comprehensive regulatory protections in place ensuring that young people who have never smoked a traditional cigarette in their lifetime, never experience the harms associated with nicotine. This bill would remove the government's current ability to keep synthetic nicotine pouches out of the hands of children, and more broadly, it would make it more difficult for the government to regulate emerging health threats in a timely manner. I would echo the comments from others who have testified before you. The challenges associated with the current NHP regulations, including the regulation of nicotine as an NHP, all merit robust public discussion. However, as witnesses last week pointed out, Bill 368 doesn't solve those problems. It simply weakens our ability to ensure that NHPs are safe for use and fails the next generation of children in terms of protecting them against the well-known and well-defined harms associated with nicotine. I'll close my remarks by asking the committee to consider the impact that this bill would have on children and their health. It's critically important that we preserve access to safe, well-regulated NHPs that serve children and families well, while at the same time restrict the sale of highly addictive substances like synthetic nicotine from our youth. I look forward to further conversations and questions about how we can improve children's health together. Thank you.
Thank you, Dr. Moore-Hepburn. We're now going to proceed with rounds of questions, beginning with the Conservatives for 6 minutes. Mr. Moore, please.
Thank you, Mr. Chair. And thank you to all of our witnesses that have appeared today. And thanks also for your suggestions on amendments. Appreciate you coming with those. Mr. Thuna, we had a appearance last week by the Minister of Health, a very animated appearance, and he made some fairly outrageous claims, one of which certainly does not reflect what I've been hearing, but I would like your comments on it as someone who's very vested in this industry. He said that the new regulations on natural health products would only negatively impact, and I'm quoting him here, people who are negligent and wildly out of compliance. So in your opinion, is this a true statement, or does the minister not accurately reflect the state in Canada of the natural health product industry.
Is that I can echo what has been said before this committee, is that our industry is, on the whole, wildly compliant. We don't sit around and question how to avoid them. We question how we can keep up and stay with the requirements. And what I can say with regards to not having anything to worry about if you are compliant, we live in a free democracy. And in a free democracy, that's a false premise. It's akin to asking, if you're not doing anything wrong, why should you have an issue with random stops and searches? I do have an issue with them. And the reason I do is I live in a free country that's supposed to be based on appropriate laws, appropriate regulations, and appropriate enforcement, so that we respect the many Canadians who fought and died for our right to live free.
Thank you. Now, I think you mentioned that you have 10 people employed at your location, and that's certainly reflective of what we are hearing and understanding about the industry in all corners of our many communities across the country, that a lot of mom and pop type shops, small businesses that are impacted by these regulations. So could you give some of your insights from your perspective on how Bill C-368 will help those shops and family-owned businesses like your own?
Bill 368 will make it so that we have an environment similar to the environment we've been living under since the creation of the Natural Health Products Directorate. And that is an environment where we know what is required of us. We know essentially what the goalposts are, and we know how to meet these requirements. The problem is, once you start moving the goalposts and keep moving them, it's uncertain. And with uncertainty, you're virtually creating a guarantee that companies that are trying to stay in compliance will not be physically able to. We're a small company. In fact, we're actually larger than most of the companies in our industry, based on a number-for-number basis, but we're still a very small company. We're very proud of that. We do an awful lot with our small staff, and we're proud of that. The biggest challenge we have is keeping up and maintaining our high level of compliance with the number of people we have.
Okay, and we're very concerned with keeping as many businesses, small, medium, and large, as possible in Canada. In today's day and age, businesses can move, and what we've heard from industry in a survey that was done is that up to 20% of businesses would consider moving if in the current context. So if Bill C-368 doesn't pass, what does the business case in Canada look like versus other international competitors?
There's not much of a business case for Canada if this bill doesn't, and if if everything Health Canada and the government are trying to put through or say they're going to put through happens, there's not much of a case for staying in Canada. And to add to that is the aggressive nature which American states are pursuing us. Wow. I, for one, have been approached by multiple U.S. states willing to give me the star, the sun, and the moon to move. They are willing to help in immeasurable ways economically to make it a no-brainer decision.
Okay. And finally, you had mentioned in your opening comments that the government's approach is taking, I'm quoting you, a jackhammer to swat a fly. So can you elaborate a bit on that, on what could be done rather than this approach?
as a member of the industry, I would be more than happy to sit down, and I know many of my colleagues would as well, with the government to work out a realistic and appropriate recall measure and system for natural health products. But having said that, before that even begins, the government, through Health Canada, should actually start using the tools they have. Having regulations without enforcement is like saying, nobody go over 60 kilometers an hour, but there's going to be no radar, there's going to be no police officers, we're going to just hope and pray that you do. And how many of us think that's actually going to happen?
Thank you, Mr. Tuna. Thank you, Mr. Moore. Next, Mr. Nakvi, please, for 6 minutes.
Chair, I want to thank all the witnesses for being here and for their testimony. I also want to sort of just put on the record that we're dealing with Bill 368 here, which deals with Vanessa's law. That does not deals with the issue of cost recovery or labeling, and I think the 20% number of business leaving was in relation to cost recovery and labeling. Let me start with Dr. Moore Hepburn. Thank you for your testimony. And you said that you have serious concerns if this bill passes, and it would undermine provider trust and consumer trust. I think that was your testimony. In a brief that was submitted to the committee by the Canadian Medical Association, they're taking the position that decisions regarding healthcare products that includes NHPs should be based on sound scientific evidence. Do you agree with their evidence? I see you nodding.
Absolutely. I think I can say that parents and patients and their care providers all need and want assurances that the products they would discuss and recommend are safe. And when you're talking about regulating all therapeutic products, we start on a foundation of solid scientific evidence, and we build on that safety and quality, as well as regulatory oversight to ensure that patients and consumers can be protected when need be.
EMA also stated in their written brief that completely removing NHPs from the definition of therapeutic products would effectively eliminate oversight of this industry and expose Canadians to unnecessary risk. Do you agree with that statement?
I think it's important that we recognize how over the last many years, the ability and the confidence of medical providers to discuss and recommend natural health products in the right patient and the right dose at the right time has significantly increased. And I would be concerned if we dial back on regulatory protections that a lot of that trust would be compromised.
Indicated that you feel strongly that Bill 368 would undermine the ability of government to protect young people from a number of potential health threats. Can you, for our benefit, elaborate further on the risks of passing C368 in its current form?
Most immediately, as the other witnesses have spoken to, the risk of synthetic nicotine is tremendous for Canadian children and youth. I think we were all, our breath was taken away when Zonic appeared on convenience store shelves. The idea of legally selling a product manufactured by the tobacco industry that was in a berry flavor to young children is truly breathtaking. And, thanks to this government, with the collaboration of national health organizations, we were able to put into place protections to make sure that young children would not cause themselves undue harm as a result of these products. So any move forward in the natural health product space must take into consideration the fact that nicotine replacement therapy and now novel nicotine-containing products like nicotine pouches are included in that regulatory oversight mechanism.
So I'm sure you're probably concerned when, as I heard from many Conservative MPs, including Dr. Alice, that they are against the action the government is taking to keep nicotine pouches out of the hands of the children. Why do you think this action is so important to protect our children?
I think that we so gravely failed children and youth when novel non-combustible nicotine products first entered the market. There was an entire generation of children who had never touched a traditional cigarette, who are now grappling with harassing nicotine addiction, and they did it on our watch. We cannot let that happen again. Nicotine pouches is a novel nicotine delivery system. We do not yet understand the full physiologic consequences over and above how devastating and powerful nicotine addiction can be to young people. We know that it affects not only cardiovascular health as well as pulmonary health, but there are long-term mental and physical health consequences that we have yet to understand. There's also the consequences associated with potential accidental and intentional overdose. So they're enormously risky, and we cannot, again, fail our children by not regulating them appropriately.
I want to come to you. You spoke about enforcement, saying regulations are important, and I think I appreciate as a business owner, you want those regulations. But you said that there needs to be enforcement. Without enforcement, it means nothing. And as I understand, that's precisely what Vanessa's law does, is actually gives the power to recall a product in case it's not meeting the regulation. So isn't it not precisely doing what you're suggesting should happen, is that there are regulations in place and there's enforcement mechanism, and if we pass Bill 368, that enforcement mechanism then is gone?
That's not exactly what I'm saying. What I'm saying is that Health Canada has been derelict for what I can safely say is my lifetime in enforcing the regulations with the tools they have. I've been doing this for over 50 years. I can say that I have been a member of my family's company for 50 years. I haven't been inspected by Health Canada in 30 years. I'm in a compliant company. How on earth do you actually expect companies to be compliant if they're slightly less equipped than we are, without Health Canada using the tools to help them become compliant and stay compliant? I actually am inspected by 4 different agencies on a regular basis. Part of the reason we are so compliant with all 4 of those agencies is because I am regularly inspected, and during those inspections, they find minor things that need to be adjusted, and they work with me to adjust them. If you work on the premise that the companies are trying not to comply, well, then your solution, okay. If you're working on the premise that, as this House has heard multiple times, we are a compliant industry, then help us comply. Don't try and slap the living daylights out of us because you think we're not.
Thank you, Mr. Tuna. Monsieur Thériault, pour 6 minutes, s'il vous plaît.
Merci, Monsieur le Président. Alors, je remercie tous les témoins pour leur témoignage éclairant. J'entends la traduction anglaise dans mon oreille.
Hearing, yes, sorry, there the interpreter was on the wrong channel. Thank you to all the witnesses for being here. We'll start over on the time. So here's what I'm looking for. As a committee, we're evolving, and of course, we are about to adopt a bill. I have heard many testimonies, except for maybe the last one by Ms. Hepburn, that in her opinion, things must be different, and it's unacceptable because of the exposure of children. I've heard from Dr. Hepburn. I'm waiting for more, but I'm hearing that you have been using natural health products for a certain time, and you've been recommending them for a little while. Before the Vanessa law, why is it that all of a sudden you think that it is problematic to have a recommendation on natural health products, knowing that the current law could make many companies go out of business? And the there might be an adverse effect, which is that products are imported from foreign countries without even being inspected or verified. I would like your answer on that.
I hope that I'm understanding your question. I'll try my best to answer it. What I can speak to is the want for care providers and parents and patients to understand their products, the products they are buying and the products they are recommending to be safe and effective. It has been quite a journey in the medical community to understand natural health products and the science that underscores their use, understanding the basic pharmacokinetics and pharmacodynamics of natural health products has been a long time coming. It has only been more recently that we've had the scientific evidence base in pediatrics to quite commonly prescribe some natural health products, including things like melatonin in certain circumstances or probiotics in other circumstances. What I can say is that it's important that we all...
Oui, j'avais compris ça, mais...
Yes, I had understood that. But before even the minister saying to stop, you were making these recommendations and you were using the products that way. So in some way, you did trust those products. If in the bill there is a recommendation for the minister to have a recall, if necessary, then do you think that might still be interesting? Here's what I'm looking for. I know that we all disagree on certain things, but I know that we also agree on things, and I want to find those common points. The Vanessa law would not have happened if there hadn't been any problems with pharmaceutical products, and you have been using those for forever. So the risk of nothing happening does not exist. The risk of adverse effects is of undesired risks are much higher with pharmaceutical companies. So why should we put an industry on the same level as pharmaceutical companies? Would you be okay with this kind of amendment where we keep this bill, but we make an amendment for the nicotine-based products? Would the parents be reassured?
So I think it's important that we all agree that any product that can have a therapeutic effect can have a therapeutic side effect. You are completely right. There is not a single drug that we would prescribe that has a traditional DIN or drug identification number that doesn't have a side effect profile. And we don't need to think about drugs as good or bad. We need to understand drugs as being right for the right patient in the right time for the right indication in the right dose. So with that frame of mind, understanding that there can always be a therapeutic side effect if there's going to be a therapeutic effect, I think it's important that we have equipoise in terms of our regulatory oversight over the products that we recommend. Recall powers are incredibly important. And while extremely rare events are extremely rare, they are incredibly important when that adverse event affects someone that you love.
Donc, la réponse à ma...
So the answer to my question would be yes. It would reassure you for us to make an amendment in order to make sure that the minister's right of recall is preserved without that being appropriated towards natural health products, because that's what 368 does. 368 makes sure that natural health products are excluded from the pharmaceutical world because that company cares for its reputation, and there are clear borders in order that for there to be safe sale and consumption of those products. So what I understand is that the amendments that I want to bring, your answer to my question is yes.
Voulez-vous une réponse,
Would you like an answer, Mr. Thériault? Yes?
Dr. Moore Hepburn? A brief response, please.
Sure. What I can say is that The regulatory protections that have been put in place over many years and most recently through Vanessa's law have heartened providers and have provided added confidence to patients and consumers over the strength and safety of the NHP product supply in Canada.
Thank you. Next, Mr. Julian, please, for 6 minutes.
Merci beaucoup, Monsieur le Président. Merci.
Thank you, Mr. Chair, and thank you to the witnesses. You're providing a very valuable and important testimony. I think it's quite clear for us, as Mr. Theriault just said, that we need amendments on the nicotine products. We have definitely understood that. So thank you for having presented your points of view on that.
Start off by stepping back a little bit. And so my question is to Ms. Butson and Ms. Patel and Dr. Moore-Hepburn. I am really surprised, and this came from Ms. Butson talks about the fact that the nicotine products were approved under natural health product regulations, and that it was surprising to me that Health Canada would simply allow this product to be distributed. So my first question to the three of you is, to what extent you were consulted or your organizations were consulted before Health Canada, under the natural health product regulations, actually approved these products? What was the timeline, and to what extent were you consulted? And then secondly, in terms of nicotine products and nicotine replacement products and pouches, I'm wanting to understand completely your concerns in terms of health impacts. Yes, obviously, it's a gateway product, but with the products themselves, with the nicotine pouches, what are the health ramifications, consequences of consuming those products, even if the individual doesn't move on to smoking? And starting perhaps with Ms. Patel.
Thank you so much for your question. I'll start off with the health impacts of nicotine pouches, because that is the biggest concern here. Speaking from the cardiovascular perspective, nicotine by itself increases blood pressure, increases heart rate, increases cholesterol levels. So these are important biomarkers, which in the short term are concerning, but over the long term can also create complications leading to increased risk of cardiovascular diseases down the line. And my colleagues have also noted the other cognitive consequences of it, particularly on learning, attention, and especially when kids are in school, these are important functions for them. So by itself, using nicotine pouch without graduating to other higher risk products like vaping and cigarettes would still be very harmful to young people's health, which is why these are very concerning products. And to answer your first question, we weren't as much involved in the consultation process in deciding on the approval of these pouches, but hindsight is always 20/20. And now that we look back, we want to make sure that going forward, kids are protected from nicotine pouches, seeing the grave concerns and the implications that they have on children and youth. Thank you.
Thank you. Ms. Butson?
Thank you for those questions. So with respect to the consultation process, similarly, the Canadian Lung Association wouldn't have been involved in those consultations. And part of it is because under the natural health products regulations, these nicotine pouches, when they applied under those regulations, were under 4 milligrams of nicotine, which is what took them outside of the way that we sort of traditionally regulate nicotine or vaping products, and allowed them to find that sort of laneway under the natural health products. So we wouldn't typically consult there, but it is one of the best examples in my experience where, you know, upon being made aware of this issue, to raising awareness about it, to government action, to actually getting these products off the shelves, I think over the span of 10 months was an incredible effort, and one that should be applauded. With respect to the nicotine pouch health impacts, of course, from a respiratory perspective, our primary concern is around the exposure to nicotine early on. And we know that the earlier that young people are exposed to nicotine, the more likely they are to develop a longer term dependence on nicotine. We're concerned about then that leading to vaping use, which we know has respiratory harms, and of course, tobacco use. And, I think some of my other colleagues have alluded to this. I think with vaping products, in some respects, we took a wait and see approach to, determine what those health impacts were going to be. And that really did lead to a failure. And so it's important that we don't wait and see, but we have the evidence in our history to know that we need to keep these protective measures in place.
Thank you. And Dr. Moore-Hepburn? Same questions.
I'm not sure I have much more to add over and above the last two witnesses. From a consultation perspective, I'm unaware that there was any pediatric input in the approval process. That would certainly not be customary when it comes to the approval of a natural health product. I would say that when these products came to market, they were positioned as nicotine replacement therapy, as a therapeutic product to help people wean themselves off of nicotine. We have seen that before. That was exactly how vaping products were introduced. And I agree that we cannot wait and see. We have to learn from our grave mistakes and ensure that nicotine replacement therapy products don't accidentally or unintentionally addict a new generation of children.
Thank you, Dr. Moore-Hepburn. Mr. Julian. Next, Dr. Ellis, please, for 5 minutes.
Thanks very much, Chair. I find it fascinating that we have an incompetent Minister of Health who allowed a new nicotine-containing product to be licensed for sale in this country, and now we have 3 out of 4, and I'll call them activist witnesses, who are clearly not concerned about a $13 billion industry that's being dismantled by the incompetent minister, but only by their niche idea. And again, if they were involved in the early decision-making, shame on them. I also find it fascinating that Mr. Naqvi talks about nicotine pouches, but he thinks it's okay to give dilaudid 8 milligrams to kids for free, sponsored by his government. That being said, this does affect the definition of what a therapeutic product is, and which also then leads down the cascading road that Mr. Thuna, who's the only person here from the actual industry, whose business will be decimated by the overregulation of an industry, which we have heard multiple testimonies, which says that these products are overwhelmingly safe. And again, I'll hearken back to Dr. Sharma's testimony many months ago when this bill, when the original legislation was introduced in an omnibus bill, which she tried to tell this committee that these products were incredibly dangerous and refused to provide any proof. And then again, we heard another testimony last time we were here talking about how terrible Deloitte was, and that their report that was commissioned by CHFA could not even be trusted. And here again, we have single entity witnesses, one who's clearly partisan, having recently worked for a minister of the Liberal government, trying to get rid of this legislation. Shameful. This is shameful. That being said, Mr. Thuna, tell us a bit about the industry. It's a $13 billion industry. My understanding is that it's mostly small businesses like your own, and many of those small businesses are run by women as well. And so are we going to, what's going to happen to all of these businesses?
That we are classified as a small business, and yet saying that, we're still larger than most businesses in our industry. Most businesses in our industry employ, from my experience, 3 or less people. A lot of them are passionate people who get into the business because of personal requirements or family requirements. And many of them are led by women. I would say, from my knowledge, probably, if not 50%, pretty darn close. There's also a high percentage that are run by minorities, many also by new immigrants. And as I said earlier, we as an industry try to comply. Overwhelmingly, we try to. I can't tell you the number of times I have conversations with companies where they say, well, how do you comply with this part of the regulation? How do you comply with this? What do you do? It's an industry where, not universally, but frequently, we actually have conversation with competitors on how to do things better. It's a friendly competition is the easiest way to say it. One of my best friends, for example, is one of my biggest competitors. And we regularly talk about how to comply. It's one of our discussions. And
I think that's a great testimony to, with respect to the camaraderie and the desire to comply to regulations. And I think you mentioned previously that, you know, if there are deficiencies at Health Canada, obviously you'll understand what those deficiencies are and work towards correcting them, not just working towards, but correcting them. And of course, you know, the issue with the demise of the natural health product industry in Canada is really related to online sales. And of course, as we've heard perhaps in the House of Commons today, the dastardly carbon tax also driving businesses south of the border. And is it true, though? I mean, businesses from Canada are either going to go south of the border or elsewhere in the world. And of course, online sales are absolutely unregulated products. Is that not true?
you can get almost anything online, be it safe, legal, or otherwise, when it comes to natural health products, or for that matter, almost any product. And we see it regularly when we go. I do many store visits as part of my job, and I can't tell you the number of times I've gone into stores and had a store hand me a package and go, can you do something like this? Can you make me this? Can you do this? Where did this come from? I would say well over 90% of the time, they're products that are not legally available in Canada. And my only conclusion is they came from an online retailer, and a consumer brought it in saying, hi, I want more of this.
Thank you, Mr. Tuna. Next, we're going to go to Dr. Pawlowski for 5 minutes, please.
Dr. Hepburn, from the lofty Sick Children's Hospital, were you not ranked the #1 children's hospital in the world, or do I have that wrong?
Well, there's lots of those lists, but yes, I feel fortunate to work in a wonderful place.
So one of the aspects of Vanessa's law that we haven't been talking about a lot, Vanessa's law requires that hospitals require any serious adverse effect of a drug. And if we were to remove Vanessa's laws from natural health products, that would no longer be the case. You work at the lofty Sick Children's Hospital. Can you give me some examples where perhaps you've actually seen that at Sick Children's Hospital, the adverse effects of natural health products, and have you reported them under Vanessa's law?
So I can't speak to any unique cases that our hospital would have reported. I can say, though, understanding the basics of pharmacokinetics and pharmacodynamics, any product that has a physiologic effect can have a physiologic side effect. At Sick Kids, we also care for medically fragile children, medically complicated children, many of whom experience what we call polypharmacy. They are on a number of different pharmacologically active substances that may or may not have drug-drug or drug-NHP interactions. It's incredibly important as we care for, especially the most fragile patients, that we understand drug-NHP interactions. And when a patient has an adverse event associated with an NHP or a drug-NHP interaction, that it be reported so that we can better understand it.
Can you talk a bit about known adverse effects of some natural health products? You're a doctor, you must deal with this at least from time to time. And the whole notion that the poison is in the dose, as one toxicologist once said to me, which I thought was interesting. So even if you drink enough water, water can be a poison if you drink enough water. So children being small are going to be particularly potentially affected by adverse effects of drugs. So can you Because we're getting this narrative from the other side. Well, these are overwhelmingly safe drugs. Can you give me some examples of where perhaps they're not safe drugs?
Well, I would counter let me start again. I agree that natural health products are safe. I feel comfortable recommending them to my patients, again, when it is the right product with the right indication, with the right evidence base to support its use. That being said, extremely rare events are not unimportant events. In healthcare, we dedicate a huge amount of time and energy and effort to ensuring that extremely rare events do not happen. And when they do happen, we report them, we reflect on them, learn from them, and act swiftly and accordingly.
Can you give me some examples of those extremely rare events with respect to natural health products?
So the natural health products that I'm not in a position to give you case reports from our own hospital, but I can say that some of the natural health products that we in pediatrics are exposed to have been cross-contaminated with products that are unsafe for children. So we have had children present with toxicity associated with contaminants from the natural health product. We have also had children present with significant complications associated with drug natural health product interactions. If, for example, a natural health product is competing for a metabolically active enzyme for one of their traditional DIN regulated products, they can either have an overdose or underdose in terms of therapeutic effect.
You talked about contaminated products. Can you give some examples? I think lead toxicity in certain Ayurvedic medicines. Can you give me some other examples of adverse effects when there's a contaminant?
So heavy metal toxicity and heavy metal contamination would probably be the one that is most common. If it suits the committee, I'd like to regroup with my colleagues to see if they can help provide a more comprehensive list of ones that we've experienced, both at the Hospital for Sick Children and with colleagues across the country.
Yes, if you could table that with the committee, it would be greatly appreciated. And can you talk a little bit about some of the common adverse drug interactions that you see with natural health products?
So if you'll indulge me in a little basic metabolics physiology lecture, there are enzymes in the body.
No, Dr. Moore Hepburn, we don't have time for a lecture. If you have a brief response, go ahead. Otherwise, I would urge you to provide it in writing. You can give us a lecture in writing.
I am more than happy to follow up with that question in writing.
Thank you. Thank you, Dr. Pawlowski. Suite, Monsieur Thériault, pour 2 minutes et demie.
Mr. Thériault for 2.5 minutes. Mr. Tuna, earlier you said that in 30 years you had never been inspected by Health Canada. Did I understand that correctly?
That is correct.
Je me souviens, moi.
I do remember that the Governor General's or that the General's verifiers that the OAG had said that Health Canada wasn't doing its job. There had been audits done in various companies, and the companies themselves were not problematic. Health Canada could not guarantee the job of making products secure and doing the right inspection so that NHPs would be safe. The methodology was also deemed biased. So 30 years without inspection. They want to go ahead and give themselves the ability to have to do inspections. Of course, it's another issue altogether that the fact that there can't be some done. But 368 is about changing the environment. You're going from the pharmaceutical world and going into and looking at NHPs for what they actually are. There are very accurate labeling of fees and so on. But 30 years without an inspection, it's actually very hard to believe. So you are not the problem. Health Canada is the problem.
I would say that the way Health Canada has chosen to treat our industry is an ongoing problem. In my time, Health Canada has, in the beginning, they didn't understand us. I would say they still don't. But in the beginning, it was that they didn't understand us, so we were drugs. Because that's the box we fit in that was easiest for them. However, what happened with the consultation and the creation of the NHPD is that was supposed to change. And it was supposed to be that we were treated and regulations were created that were right for us. The Health Canada was supposed to educate consumers, supposed to educate also doctors and other medical staff so that they could better understand, A, the regulations, B, the products, and see how they're manufactured and how they were going to be kept safe. Health Canada fell on its butt with that one.
Thank you, Mr. Tuna. Over to Mr. Julian, please, for 2.5 minutes.
Thank you very much, Mr. Chair. I'm going to continue with you, Mr. Tuna, and thank you for being here. You testified that the cost of compliance, $500,000 for the first year, $300,000 for each year afterwards. What are your total sales per year?
As we're a private company, I can't give exact numbers, but I can say we're well under $5 million.
Okay. So the cost of compliance would 10% potentially of your overall sales?
The cost of compliance would bankrupt us within a matter of months.
Okay. You also testified that you received inspections from 4 different agencies. Could you share with us which agencies?
Sure. We are regularly inspected by an international GMP agency called SGS. That is entirely voluntary on our part. We are also inspected regularly by the Kashrooth Council of Canada.
Sorry, the which?
Kashrooth Council of Canada, again, entirely voluntary on our part. We are also inspected by both EcoCert USA and EcoCert Canada, which are 2 organic certification companies. All of those are voluntary because we, as a company and as many companies in our industry, try to meet and exceed standards.
And those inspections then, are they on a monthly basis, an annual basis to keep your certification?
The organic ones and SGS are annual. Kosher is quarterly. And those are physical in my building, going through paperwork and actually walking through my facility, talking to my people and inspecting.
And how long do the inspections normally last? Is it a day or?
Anywhere from a couple of hours to a couple of days.
Okay. One of the things that we've heard from, and the vast majority of companies in the natural health products sector, as you know, are fully compliant. They have, when there is a voluntary recall, they have complied. We have heard of 3 cases where companies did not comply, and from what I understand now, all 3 of those companies no longer exist. They're no longer in business because they no longer other tools have been used. Have you ever received a voluntary recall notice, or have you ever had Health Canada express any concerns about any of your products?
We have had Health Canada come in and question us regarding labeling. We have had Health Canada come in and question us over a name issue, but both of those were in, if I recall correctly, I am aging, they were in the 1980s, long before NHPD existed, and they were resolved to Health Canada's approval. That's the wrong word, but they were happy in the end based on legislation that existed back then.
Thank you, Mr. Tuna. Thank you, Mr. Julian. Next, Ms. Goodridge, please, for 5 minutes.
Mr. Chair, and I want to thank all the witnesses. I really appreciate the conversations that we've been able to have here today, and it's actually been really interesting because it's not necessarily on the subject at hand. It became on the subject at hand because the government decided to use a very blunt tool. And so I'm just going to walk us back a little bit. In November of 2023, it became known and it was called out that the government was allowing nicotine pouches to be sold to kids. And as has been pointed out by many of our witnesses, basically on shelves beside candy. And the minister got all puffy, the Minister of Health, and made a big deal saying that this was absolutely unacceptable. And yet, according to Imperial Tobacco, they said they simply applied to Health Canada and got approved. So it sounds to me like this was a Health Canada could have intervened and chose not to situation, and a lot less of let's completely rewrite the entire natural health products piece. And then it took 10 months before they actually came up with regulations, and the regulations don't actually deal with like nicotine, as has been suggested by my colleague from the block of potentially having just a specific carve out piece. It literally is let's try and bankrupt a $13 billion industry. And so, Mr. Tuna, I'm really interested. You've been talking about how Health Canada hasn't come into your business since the 80s. So 30, 35 years was the last time you heard from Health Canada in your business?
We communicate with them regularly.
But like inside your business?
Correct. And that from the conversations I've had with colleagues, and I've had many, it's entirely commonplace for companies to say that. Health Canada is viewed as dropping the ball when it comes to enforcement for companies that actually care about the industry and care about enforcement.
So as you've been sitting here listening to the testimony, and every one of the witnesses that are bringing up their concerns about nicotine pouches being sold to kids are correct. I think this is something that is deeply concerning to just about everyone sitting around the table. As our addictions shadow minister, I don't want to see children getting addicted to a substance that we know is addictive. But I also don't want to see good products that people use to sometimes to help cure themselves from their addiction removed from the products available to them as a direct result of this. Do you think that Health Canada should be doing more when it comes to inspections or using any of the other tools that they have at their disposal?
Not only do I think they should do more, I should think they should actually do something. My personal experience is Health Canada does not use the tools at its disposal, yet waits until something is in crisis or near crisis mode, and then pulls out the jackhammer.
So Dr. Moore-Hepburn, do you think that a 10-month delay from the time that these pouches were on the shelves to the government finally acting was responsible?
I think as a practicing pediatrician, what I can offer to the committee is that it's important that we have the complex and complicated conversation about how it is we're going to regulate nicotine more broadly, how it is we're going to maintain and preserve access to nicotine replacement therapy to those individuals who need it, while simultaneously restricting access to new and novel threats. I think that is a broader conversation that's important for the public to have.
Okay, but I'm asking you a very specific question. It took 10 months for the government to actually do anything to prevent kids from being able to access these products. Do you think that was fast enough? Would you have preferred it to have been sooner? Yes or no?
I think everybody looking through the retrospective scope would have preferred that the products not have been approved as they had been. And obviously, any time that the products were available is too long a period of time. Speaking to the speed at which government can and should act is outside of my area of expertise.
Fair enough. So my next question is, Ms. Patel. The Minister of Health previously worked for the Heart and Stroke Foundation, is that correct?
And I'm aging myself here. When that happened, I was still in high school, so it's been quite a while.
Okay, I'm just.
Thank you. Ms. Goodrich, that's your time. Next, Ms. Sidhu, please, for 5 minutes.
Thank you, Mr. Chair. Thank you, all the witnesses being with us. My first question goes to Canada Lung Association. Ms. Burton, do you think the government should be able to use an injection to stop the action of non-compliant company if there is any immediate risk of human health?
Are you speaking directly to recalls? Could I just get a clarification on that?
Yeah.
So is that with respect to a potential amendment that would speak to the right to recall?
Yeah. Can you explain that?
So that wasn't part of our particular call to action, although I did hear it referenced earlier. Our sort of speech here today was really with respect to the impact on the nicotine products and the potential to amend so that this did not apply to nicotine products.
Ms. Patel, what are the risks associated with the passing with the C368 if it's confirmed, if it passed?
Effectively orphan out nicotine pouches and nicotine replacement products. Right now, we regulate tobacco, cigarettes, and vaping products under the Tobacco and Vaping Products Act, the TVPA. And then the NRTs, or nicotine replacement therapies, and nicotine pouches currently fall under the Food and Drugs Act. But if natural health products are taken out of the definition, then we have no framework to regulate it under. And as Dr. Moore-Hepburn has repeatedly stated, these pouches are a big concern, and we want to keep these protections around. Tobacco industry is not going to stop at pouches. They're going to keep coming back with new innovative models. They'll try to, I don't know, inject nicotine into candy apple and call it a nutrition-forward way to quit smoking. We don't want that. We want to be there to protect kids with regulations and ensure that the industry doesn't keep profiteering from nicotine addiction.
Thank you. And Dr. Hepburn, in addition to the concerns raised already, you did that, about how this bill would impact regulations on nicotine products. Are there any other concern you have with how this bill could affect to young people?
So again, I am a practicing pediatrician who cares for patients. Many of my patients use natural health products. The Canadian data that we do have is really based on a single center study, which has inherent limitations, but best estimates are up to 2/3 of families use complementary health practices in some form or another. This is a huge part of our patients' lives and their families' lives, and I am not here to stand in the way of that. That being said, I think it's important for care providers and parents and patients to have assurances that the products that they buy are safe. And rare events related to safety are not unimportant events, especially if that adverse event or drug-drug interaction involves someone that you love. So if there is a call to have a broader conversation about how we can best regulate NHPs, I think it's important that the medical community be at the table and would again just reemphasize the importance of addressing the synthetic nicotine issue as a part of that conversation, given how Canada currently provides regulatory oversight in synthetic nicotine.
Thank you. Again, I would like to ask Ms. Patel your question. Nicotine products is now, right now, they are classified as a natural health products, not the therapeutic products. But if this bill passed, they will no longer be subject to Vanessa's law. Do you have any recommendation how nicotine products should be categorized for the purpose of regulations?
Heart and stroke is not too prescriptive in telling the government how it should be regulated. We just want to make sure that the regulations as they exist currently should be kept in place and protected. Our concern is that the bill would revoke those existing ministerial orders that were put in place in August, which are vital in protecting kids and ensuring that these harmful products stay away from them.
Thank you. Do you have a more minutes? So, Dr. Hepburn, do you want to say anything on that?
So I would agree in terms of not being prescriptive. We prescribe lots of things, but not in this space. I do think, however, that it's useful to consider having a broader conversation about how we can approach nicotine, as there is this clear chasm between what's regulated under the TVPA and what is regulated in the Food and Drug Act. There are many competing and important priorities that need to be balanced. And with this new threat, we need to have our eyes open and we need to not wait and see what will happen as it takes hold in our markets.
Thank you, Ms. Sidhu. Colleagues, we're now through 2 full rounds of questions, and we have resources to continue. I know there are some people that are going to be heading to the airport fairly shortly, and I don't want to get cut off by a motion for adjournment without raising a couple of things with you, because we're heading back to our ridings next week. So there's a couple of things I need to raise with you, and then I'm happy to continue rounds of questions or entertain a motion for adjournment after that, as you wish. 2 things. First of all, on the opioid study, because we Tuesday agreed to extend that study, we need to have you replenish your witness lists. Can I suggest that we have new witness lists or supplementary witness lists to the clerk of the committee by next Friday, November 15th? Does that seem like an acceptable deadline? Thank you. Secondly, in connection with this private members bill, we are scheduled to do clause-by-clause examination of this bill 2 weeks from today, so on the 21st of November. So could I have the agreement of the committee to set as a deadline November 15th for amendments and the submission of briefs? Is that okay? Everybody okay with the November 15th deadline? Thank you. Sorry?
Can we do the 19th?
Just hold on a second. So the 19th would be too tight? I have a suggestion of the 19th. So can we set the deadline for briefs and amendments for November 19th at noon, please? Everyone okay with November 19th at noon for amendments? Okay. All right. That's what I wanted to get in before we adjourn, and so we can okay. So the next turn goes to the Conservatives. Mr. Doherty, please, for 5 minutes. Oh, yeah. So we have a point of order. Mr. Julian.
Thank you, Mr. Chair. Some of us have airplanes that are already moving down the runway. So what I would suggest maybe is 2.5, just to round off from the two parties.
How do we feel about you mean 2.5 for the Liberals and Conservatives?
Yeah.
Okay.
Because at 5:30 I have to leave.
Can you keep your round to 2.5 minutes, Mr. Doherty? Okay. You have 2.5 minutes. Oh, Dr. Ellis.
Thanks very much, Chair. Dr. Moore Hepburn, I had a question for you. You know, you talked about 20 years you've felt comfortable with natural health products. Do you think that this legislation is going to make them less safe?
So my reference to my 20-year career is how much has changed in terms of primarily the evidence base to support or not the use of natural health products. The regulatory infrastructure, it was stable for most of that time, but I would say that the broader medical community really celebrated Vanessa's law and its inclusion of natural health
I have to cut you off there, Dr. Hepburn. You know, this is not about Vanessa's law. This is changing the definition of a therapeutic product. That being said, the other question I have, do you know how many, and I know this is not your area of expertise, but how many seniors are hospitalized every year because of prescription drugs?
I don't know.
That's 13,000. And, you know, I guess I have a little bit of as you noticed in my first round, a little bit of a problem that you're hearing on one issue that's decimating a $13 billion industry, and you couldn't even provide any examples of how many children have been injured by
point of
natural
order,
health
please,
products.
Mr. Chair.
order?
Respect for our witnesses would be appreciated, please.
This is not disrespectful. This is questioning testimony. Thank you very much.
Thank
So,
you.
Dr.
Henley, go ahead.
Hepburn, you know, the question is, how many children? You couldn't even name a child or tell us how many cases you've dealt with. I find that disingenuous. I hate to say that to you because our colleagues obviously believe of your esteemed nature, but please come to committee prepared when you're trying to decimate a $13 billion industry.
Point of order from Dr. Hanley.
The witness is being asked to give privileged private health information from a health care institution.
Thanks very much, Chair. I'll pass my remaining time over to my colleague, Mr. Doherty.
Doherty, please.
Ms. Patel, have you at any time worked for the government as a legislative assistant for any members of Parliament or any ministers? It's just a question.
Hand.
It's a yes or no?
Yes.
Thank you.
Dr. Hanley, please, for 2.5 minutes.
Thank you, Mr. Chair. If I'm attempting to understand the conservative mindset, and that's an exercise rather like plunging into a labyrinth of illogical thinking and dead ends. But conservatives today are lamenting a 10-month delay, but actually objected to the ministerial decision to put nicotine replacement products, the pouches, behind the pharmacy counter, a measure to protect access to youth, because adults having a choice of therapeutic nicotine products was deemed to be more important. But at the same time, there is a very real problem of market influence from unregulated vape products, some of which are alarmingly potent, with up to thousands of hits per vape and easy to access. So hopefully a little time, Ms. Butson, with you. Have we got the balance right between reasonable access for adult smokers to NRTs, limiting access to youth and preventing access to unregulated foreign imported products? I had to ask you to be very brief because the time is so limited. I wanted a chance for Dr. Hepburn to comment.
Just really briefly, with respect to the ministerial order, which we're trying to keep protected through an amendment in this proposed bill, the balance, I think, is struck there. Where the products are not banned, they are still allowed to be accessed by people who smoke, who are seeking to use them to quit, but they're not appealing to young people, and they're not easily accessed by young people.
Dr. Hepburn?
I would agree that there's a delicate balance we need to find. We need to make sure that adult smokers have access to NRT therapy, but it's packaged in a form and made available in places that would not be attractive or appealing to young people.
Thank you. Do I have any time left?
45 seconds.
Oh, great. Thanks. I was interested, Dr. Hepburn, in I think you said your appreciation over time for natural health products has increased. And that knowing that NHPs are well regulated means that you're more comfortable recommending. So how important do you think it is for consumer confidence? You have a lot of interactions with patients and clients who are accessing these. How important is that added level of safety for, do you think, confidence for practitioners and consumers in natural health products?
I want to be clear that I don't in any way wish to dismantle the industry. Many patients and families rely on these products, and they have become part of standard medical practice in many specific instances. So I want to, again, state that my goal is to make sure that there is provider confidence and children, we can recommend the use with the safety and certainty that the product that they are getting is what they say it is, and that adverse events will be reported when they do happen.
Thank you, Dr. Moore Hepburn. Thank you, Dr. Hanley. And thank you to all of our witnesses for being here with us today and for your patient and professional approach to the proceedings, for your advocacy on behalf of the industry, your stakeholders, and your profession. As you heard, we're going to be wrapping up testimony at our next meeting and then moving on to clause by clause very shortly after that. The information that you've provided today will be immensely helpful to us in that regard. Is it the will of the committee to adjourn the meeting?
Yes.
We're adjourned.